TRT is not just for cosmetic reasons or performance reasons. There's actually a lot more to it. For health, TRT can actually prevent heart disease, osteoporosis, mental health issues.
Good day and welcome to the Leo for Men podcast. I'm joined today by my co-founder and partner, Elmore Engelbrecht, Dr. Elmore Engelbrecht. And we're here to tell you a little bit about Leo for Men, a little bit about the story. You'll hear more about Elmore's background, services we're going to offer, and everything that we're planning on rolling out in the coming period. My name is Michael Cook. I'm co-founder and kind of the prototypical patient for Leo for Men. So I'll be acting as the host of the podcast, and Elmore is the brains and the talent behind the business, and he's going to give us the background of his story and how he came to be to launch Leo for Men. So Elmore, welcome.
Yes, thank you, Mike. Yeah, so I'm Elmore. I'm a physician here in private practice in Calgary, where we mostly focus on regenerative and cosmetic medicine. My background, I grew up in South Africa. Enjoyed the farm lifestyle there, I guess, and early on got involved in the sports, craziness in South Africa. So that's, I guess, where my journey started. Playing sport and always looking for a little edge. Why is this guy a little faster than me? What can I do better? Do I need to supplement with nutrition? Do I need to work out more than the other guys? So I was always interested in regenerative medicine or sports injury prevention, and so I guess that took me to med school in South Africa. Went to Stellenbosch University and I guess furthered my studies there. And quickly I guess got to a point where it's I don't just want to cure illness. What can we do preventative wise, improve your lifestyle and, and longevity. So did my medicine there. And then we started, I did a postgraduate diplomas in some dermatology and also in sports medicine, endocrine health and all those kind of things. The interesting that led me to the I guess hormonal men's health, replacement stuff, working with a lot of patients that, even professional athletes and, people who's fit and eat well and healthy and things, but they just start to kind of hit a bit of a wall maybe, they get into their 30s and 40s and it's like, okay, I eat well and I do everything right. Why am I hitting a wall? So I guess, that's then kind of where the journey started, doing a bit of more research. And I guess what really changed my mind a bit is seeing some of the studies. There's some very good, interesting studies that came out on, what exactly is testosterone and what does TRT really do for you? And I guess what really changed my mind was one of the studies showing that TRT is not just, a hormone replacement for cosmetic reasons or, performance reasons. There's actually a lot more to it, for health. And how actually a game changer for me was seeing how TRT can actually prevent some serious illness, including heart disease, osteoporosis, mental health issues. So it was, it's not just a treatment, for sexual health or for, performance.
Muscle.
Yeah. Or gaining muscle. Exactly. Yeah. So this is actually a medical treatment.
So maybe even before we, touch on all of the benefits that testosterone can provide, maybe even just for the folks that are listening, just maybe even give an overview of, we throw this word around all the time, testosterone, it's especially in our current age where, being a man is sometimes even ridiculed or questioned. Maybe even just touch on testosterone, what it is and how it impacts us just generally.
Yeah. Well, testosterone basically is the main male sexual hormone. We know, where it comes from cholesterol, and then down the pathway, um, testosterone gets, then produced in the testes. So it's your male hormone, but it's not just a sexual hormone, for various reasons, like we just started touching on there. So it's basically, you can almost put it, it's the fuel that run a man's engine, for, various reasons, the muscle and bone density. It produces, some, red cells for you. So I guess it's the main hormone for men to kind of fuel your system.
Well, and I mean, you and I were both in our 50s. I mean, I know that may be surprising to the people listening, but
painful to hear. Yes.
Yeah. We've kind of gone through this process together, and part of the process of identifying people that are eligible or appropriate to consider testosterone replacement. I mean, it's a questionnaire, and it basically gets the individual man to self-assess. And some of the things I think we all recognize as we age is we remember what it was like when we were, in our 20s. And is it accurate to state that, your testosterone is higher when you're younger and it just naturally declines? Or what does that path look like?
Yeah, that is correct. Yeah. So one of those studies that I mentioned earlier actually showed where so you produce your testosterone, it peaks, into your mid-20s. But it's actually pretty common to see, like from as early as, your late 20s or 30, where testosterone starts declining. And then, there's a percentage that they work out, 1 or 2% a year, that it just keeps declining from there. And that is for, people without any other pre-existing conditions. There's people who's more genetically predisposed, or, got some other, medical issues or even injuries that can cause it even earlier. So that's actually, that's correct. And that's one of the myths actually of, this, is testosterone replacement just for old guys? And it's like,
right.
Not really. No, it's, it really starts declining from 30.
From 30. Okay.
Yeah.
And so when, men are considering, thinking about testosterone replacement, what are some of the signs that, hey, maybe I might be, eligible for this, or it might be appropriate for me as an individual?
Yeah.
Like, what are the signs that people would start saying, maybe my testosterone is flagging a bit? Like, what are some of the signs?
Yeah, there are a few various symptoms. People will often start and just saying, you know what, I'm just starting to hit a bit of a wall. I feel a bit more fatigued. It feels like my performance, maybe sports wise, is a little, starting to decline. Sexual wise as well, men will definitely notice some, decreased libido and erectile dysfunction. And then it's interesting that it's actually linked to some, depressive symptoms as well. Feeling a bit more depressed or down, or just not, I just can't get going, kind of a thing. They might also maybe a little later on in that, start, noticing some muscle mass loss. If you do some scans, it's like, okay, it looks like the bone density is maybe changing a little bit. So I guess, sexual wise, the libido, erectile stories, feeling fatigued, and just a general kind of a feel of, I just, can't really get going.
Right. Okay. And then, I mean, those are obviously the qualitative observational elements for, recognizing, hey, I might be, a candidate for this. But what's sort of the scientific side to sort of assess whether someone is, a good candidate for the TRT? Like, what do you look at as a physician for that?
Yeah. We will typically do some blood works as well. If someone presents to my office and be, mentioning some of these symptoms, then you will do some blood works just to check. There are other medical issues as well that can, potentially cause the same symptoms, like thyroid issues, So we'll do some blood works, and we'll probably do like a whole panel of blood works. Testosterone is not seen in isolation. It's a whole, orchestra of hormones and things that play a role here. So we'll test the testosterone levels, both like the free testosterone. We'll do the total testosterone. And then we'll assess a few other hormones as well in the pathway. Like as I mentioned, cholesterol is kind of the starting thing, and then it goes to pregnenolone, testosterone, kind of a cascade. So we'll check that, check the hormones, and then also rule out a few other things that can potentially cause your symptoms. And then that will give us a good idea of where we're standing. It's always a good idea too to maybe do a bit of a trend, so test the levels to kind of just see, because testosterone, there's a very wide range, that kind of is considered normal. So we'll maybe do a bit of a trend and see if you're slowly declining, and it was it's still considered normal range. That will give us a good indication.
I imagine too that the range and the trend you're talking about is also probably something that you will be overseeing for the patients of Leo for Men Clinic. Like, if they become a patient, you would probably check their baseline testosterone levels, the different kinds that you mentioned. And then as they continue on as a patient, you're probably, checking that over time as well to see what that trend looks like.
100%. Yeah. And I think that will be important, definitely just with certain of the side effects and things that can come with certain of these treatments, it will be very important, to monitor someone. Typically, if someone will start on a treatment like this, we'll probably do their repeat blood works as soon as 6 to 8 weeks later. And then keep an eye on a few other things as well, that can be involved, including, like maybe prostate checks, check their complete blood counts and make sure, there's not a change in the red blood cells. So that will be crucial to follow up and regularly check blood works and monitor. Yeah.
Well, I mean, clearly, for men our age, and I mean, even as you say, for 30 plus, we all hear that terrifying, P cancer word, and that is something that is on most of our minds, the prostate cancer. What that is, that a common myth that's associated with testosterone replacement therapy? Like, is it going to directly lead to a higher incidence rate of prostate cancer, or can they be unrelated?
Yeah, it's a good question. So there's always been testosterone stimulate, some cell growth in the prostate. So that's always been a concern, can testosterone, cause prostate cancer? And the answer to that is like there's quite a few newer studies out now that shows testosterone replacement per se will not directly cause prostate cancer. If someone is predisposed to it, or someone who has prostate cancer, obviously they will be a contraindication because of the cell growth. But the testosterone itself, actually, some of the newer studies shows it can actually be protective, prostate protective. So it looks like, with the newer studies, like as long as it's not someone who's predisposed to that or has got an existing, cancer or problem, that actually the testosterone replacement, as long as it's done, in a responsible way as well. The idea is to get it in a physiological, normal range, not overtreat. It looks like the incidence of that is very low. And we can keep monitoring, so if you go on this, one of the things we will check is your PSA, the prostate check, and keep an eye on things like that. But so testosterone replacement per se in a healthy individual will not cause prostate cancer.
Okay. Now, I mean, obviously that is a major concern, but also one of the benefits of working with a physician such as yourself who is expert in these areas. I mean, that's a key element of the program, is you want to just do it not with someone who is just dabbling in it, but someone who is really focused on this. That's obviously a key element to understand what these markers may mean and the trends and all that kind of stuff. So that's an important consideration. And I don't want to dwell on that too much, but what are some of the other myths that come up with respect to testosterone or testosterone replacement therapy that you've heard?
Yeah, I think what sometimes happens, people confuse a little bit testosterone replacement therapy with anabolic steroid use. So what some will be, can I get what they call or refer to as roid rage? Will this make me, aggressive and angry? And that's exactly that. So testosterone is not the same than an anabolic steroid, and that gets, I guess, abused, people use that at very high levels, which then can cause, some of those symptoms. So actually, to the contrary, testosterone, if used in a responsible way, should actually help mentally and, not cause the aggression or calm people down even. So I guess that's one of the things, is not to confuse the two. Other problems, guys, is like, will I lose my hair if I go on TRT? And it's the same there. If TRT is done in a healthy individual, it shouldn't cause any problems there. What can happen is that testosterone gets converted into what they call DHT, and that is a different form of the testosterone that can harm hair follicles. So in people who's got a genetic, predisposition for hair loss, there is a possibility that the testosterone can cause that. We do have a few options, available if that, is a concern to someone. Some medications and things that we do that can block that conversion from testosterone to DHT and then not cause that. I think one other thing people are a little bit concerned about is, guys who still, want to have kids, can this cause infertility? You do want to check a few things, so testosterone, when you replace with that, can suppress your normal, testosterone production, which then can lead to a lower sperm count. And that can potentially, affect things. So it will be important, if, a guy in his, early 30s wants to treat that, to check a few other markers as well. And then again, there are things that you can do, including something like HCG that they will sometimes inject to kind of try and counter that part. And then, some is like, if I go on testosterone replacement, will I build, will I look like a bodybuilder? And it's, kind of the same thing. It's like, no, not if TRT is done in a responsible way, and, you just aim for normal levels. It's not an anabolic steroid, so it should not, cause that.
But would it also, though, correspondingly lead to obviously, as you age, your ability to build and retain muscle declines. I'm assuming that relates to testosterone. And if you're using TRT, is your ability to build and retain muscle increased as long as you do the work?
Yes. Yeah. It will certainly, it will stimulate that. So testosterone will give some, muscle stimulation and muscle growth. So as I say, it's just
not by sitting on the couch, though. You do actually have to do the work.
Still have to do the work. Like lifestyle thing is always important. Need to work out and eat, clean and all of that. So, so if you do testosterone at a physiological levels and things, you'll easier, build muscle but you're not going to be a, form bodybuilder muscle if you, not use anabolic steroids.
Right. Okay. Yeah. So for the people that are interested in sort of this whole concept of testosterone replacement therapy, like what does the journey look like? What can someone expect to, experience and go through as they, go through this testosterone replacement process and journey?
Yeah. Like I'll sometimes even look at it as like, it's not much different than, taking your vitamin D, where we're living and things. It's like, you've got a deficiency, and it can actually harm your health in the long run. So TRT basically is it's a medical treatment aiming at getting your testosterone to, physiological or normal levels again. So a typical process would be, we've identified, your symptoms as, like looks like you're low, your blood works maybe confirm that you're low on that. Then we'll discuss the different options. As testosterone come in several forms, including injectables. You can do a gel or a patch even. There's some newer things out there now where you can even implant a little pellet under the skin that can, be like a slow release. So I think it will be, discussing it with your physician, what kind of form will work best for you. So then it's a prescribed medication. One can get it, delivered straight to you, and then, probably just discuss what are the, what is your preference? Like, do you want to come in, twice a month and get an injectable, or do you prefer maybe just to use a gel? And then I guess you just take it like you take your vitamin D. And we'll, and then reassess you after your first treatment 6 to 8 weeks later, make sure that everything stays in check, and basically go from there.
And would a typical man notice a change within 10 days or something like that? Like if they're really trying to be conscious of their bodies and their situation?
Yeah, typically not that soon.
Okay.
That's another myth. Some guys will be, if my energy is low, if I take testosterone today, will I be fixed tomorrow? We find testosterone probably 6 to 8 weeks before you'll really start noticing the benefits. And then from there, it will just, keep improving. But yeah, you probably 6 to 8 weeks before you'll really, notice a significant difference.
Okay, good. Now, with respect to that, I mean, we talked at the outset about, going through this process, answering the questionnaire, doing the assessment. The other side of it would be, is TRT, right for everyone?
TRT is not right for everyone.
Right.
It is definitely important to individualize here. There are people with certain, again, pre-existing conditions, including, prostate cancer. Even people with other issues, maybe there's a different hormonal, abnormality. They might have some thyroid issues. And maybe their levels, are in a physiological or a normal range anyway. So then we'll be a little careful. It's like, maybe there's a few other things we need to normalize first before we address that. Maybe some, guys in the, younger who still, want to have kids. It's like maybe look into the potential, temporary infertility that you can get from this. So no, it's important to individualize, and even, so two different guys going on testosterone treatment, we're not going to treat you the same. Everyone is different, and everyone's, hormones and physiology is different. So we will definitely individualize and rule out, it's not for everyone.
What about sort of the stigma associated with being on testosterone replacement? I mean, obviously at Leo for Men, we're focused on privacy and maintaining that confidentiality and that kind of thing. I would imagine, though, that some men would be uncomfortable with even talking about the fact that, yeah, I'm on TRT. What are your thoughts on that?
Yeah. Yeah, I think it's maybe, we as guys sometimes it's like, you feel like you have all those symptoms. And it's like, should I just man up? It's like, you don't really want to talk about it. It might say, it's like, you just man up, or, or maybe I'm just old. I should just, accept this. So I think the newer research is, it's come a long way, proving, what the testosterone can do for you. How it can actually prevent certain, diseases and problems. And, that it's, there shouldn't be any stigma about it. It's a medical condition. You can, like you treat diabetes or you treat depression, there's a stigma about taking, antidepressants. But I mean, we know by now, what the studies have showed and all the benefits from that. So I think we've come a long way now where people do understand how it works, what it can do for you, how much better you can feel on that. And, it can really be a game changer, as long as it's done in a responsible way and, and monitored regularly.
Well, I think that's true. And I imagine part of it is even just given the fact that, compared to our, grandfather's generation or even our fathers, our life expectancy is longer, but also the fact that we want to live our life, to the fullest through that period and not just sort of, gradually decline. If we can maximize our impact and our enjoyment of life, and we can, utilize a tool like testosterone replacement to continue to enjoy the things that we have all the way through, our youth and sort of middle years, why not? Why shouldn't we consider that?
Yeah, 100%. It's again, it's a medical condition now, right? It's recognized as a a problem that can and you can actually get some serious issues, not supplementing with that, in certain cases. Not much different than saying a diabetic, who can get certain complications. You obviously want to optimize their treatment and and prevent complications. So if you can get treated, you do well. Energized, vitality is good, lower risk for heart disease. Some abdominal fat, dispositions and things that the testosterone can help, which can lead to heart disease, osteoporosis that can potentially come. There's even some studies now that show cognitive wise how testosterone can actually help or prevent, something like, the development of Alzheimer's disease.
That sounds appealing.
Yeah.
Do you, not to totally pivot, but I'm just kind of curious, we hear a lot about the environmental toxins we encounter and the fact that, in plastics and everything that we encounter in the environment, that may also lead to some kind of either decline in our testosterone or an increase in the sort of the female hormone estrogen, which probably has a negative effect on testosterone. Do you think there's any validity to those sort of observations?
Yeah. There are some, identified toxins out there, including what you mentioned, some of these plastic, byproducts and things that either break down, that can definitely affect that, like other conditions too, some viral illnesses and a few other, environmental toxins that they've identified. So yes, yeah. So I guess part of this treatment will always be the lifestyle thing. Make sure you eat healthy and clean. Do your workouts and stay away from certain toxins and some certain byproducts.
Well, and I think that relates to conversations you and I have had in the past, where you can take the TRT, but you also have to do some things to actually make the most of it. And, I joked about you can't just sit on the couch and all of a sudden you're better.
Yeah.
Are there things that you would sort of, encourage or recommend that would maximize the impact of the testosterone replacement therapy for individuals?
Yeah. There are several things, again, part of the lifestyle thing, so healthy diet that you want to do. There's certain foods, healthy fats, including things like avo and, some healthy oils, fatty fish, those kind of things that can help, stimulate that. Something like muscle training, workouts and things, there's a few things that you can do there to try and, boost your potential there. Avoiding certain toxins again, including alcohol, that can play a bit of havoc on that too. I know. Yeah. To rule that one out. So, So yes, 100% what you're saying there, it's not just, here's your TRT treatment, now you can sit on the couch and, we'll see you in 3 months again. It will always be important, to do the lifestyle thing.
Right on.
Yeah.
Well, I think that's a pretty good overview for, the individual listening. Yeah. Obviously, Leo for Men, we're basically launching health services for men by men, recognizing the needs and the nuances of men's situations, their busy lives. We're doing everything in a way that is privacy preserving, recognizing your busy schedules. We're conducting our process, often through online private meetings. We'll be delivering product to your home in, unidentifiable envelopes, all that kind of stuff. And I think that's an important part of it. We're focusing on testosterone replacement, obviously, and we're going to follow up with other episodes where we're going to talk about the other things we're going to focus on at Leo for Men, including weight loss, hair loss solutions, wellness and supplementation, detox, as well as, one of Elmore's other expertise is cosmetic solutions for men. So all these things, we're really interested in working with you and meeting you, and you get the benefit of of working with Elmore, who is an expert in all these areas and a really great guy.